everybody, and welcome to another pregnancy update vlog. This will probably be the last update before baby Melody is born. I'm currently 37 weeks pregnant. I am very pregnant currently, and I feel like I haven't filled you guys in on some of the stuff that's happening, and I feel like it's been a really long time. But I looked at when I posted the last update and it was at 28 to 31 weeks, so it really has only been about 5 weeks, but I feel like it's been a long time. So the last thing I showed you guys was me getting my blood work done for my gestational diabetes glucose test, and I passed that. I do not have gestational diabetes, so I did not have to go and get any more blood work done. I was 32 weeks. We went back to the high-risk pregnancy center to get another ultrasound done. This time they did the 3D ultrasound, so we got to see pictures of little baby Melody, which I can show you guys here. We got to see her little face. I'm obsessed with her little nose. Her little nose is all smushed up against my belly and it's so cute. They did tell us that her feet still do look club-footed, which we kind of figured. I didn't figure it was going to be something that would change, considering we've seen a few other ultrasounds with her feet club-footed. I did have a virtual appointment with the neonatal center just to kind of talk to us about how this delivery might be different and how there might be more people in the room. There's going to be more people in the room, just to kind of see if for some reason why she would have to go to the NICU. A lot of the times being club-footed is a result of other things that could be wrong with the baby, which nothing has stood out as to that being the reason. This kind of just stands out as being something that's hereditary because being pigeon-toed runs in my family. So they're just kind of there to make sure everything is okay. So they'll definitely check on her to see if anything else might stand out as a reason why she might need to go to NICU when she's born. They did tell us what would happen with her feet getting casted if she was in the NICU. But as of right now, they're saying that's probably something that's not going to have happen, but they're there just in case. And it was kind of good to know and have the expectation of what might happen, and just to know why there's more people in the room. To be honest, I couldn't tell you how many people were in the room when I delivered Caspian. I was just focused on pushing, and I didn't really think about anything else because for those of you guys don't know, I did a 100% medication-free birth for Caspian, and that's what I want to plan to do for Melody. So I didn't have any sort of pain meds or anything. They put me on Pitocin, and that was the only unnatural thing I did, if you will. But I am currently 37 weeks pregnant now. I did have an appointment on Monday. At that appointment, my blood pressure was high, which kind of freaked them out. So they unfortunately sent me to get more blood work done, which you guys know how much I love blood work. I thought I was finally done getting blood work, and they sent me to get more, but I did just find out that all my levels are normal, so there's nothing really to be concerned about. But just happened to have high blood pressure at that moment. They took my blood pressure twice, and at one point it was 145, and they say anything over 140 is to be concerned about. I took it again and it was at 132, and my normal is 120 something. So I definitely can understand why they were concerned, but I'm glad that there's nothing to be concerned about in that sense. And so far I have gained 28 pounds with this pregnancy, and I literally have only gained it in my belly. What's really interesting is by this point I had already had Caspian. Caspian was born at 36 and 5, and I'm 37 weeks now. But by this point with Caspian, my body had definitely swollen up. My arms had gotten swollen. I swelled up in my face. My legs had swollen, and I haven't swollen up or anything. It's literally just all belly. Nothing else has changed except my belly. So it's been interesting to see how this pregnancy is different. I have been having contractions, and I keep saying I just need my water to break because I have such a high pain tolerance. I can never tell if they're really anything to be concerned about. I had contractions at work on Saturday, and then on Monday night I had contractions as well, and my contractions went on for maybe about 45 minutes, and they're about 12 minutes apart, but then they stopped. So obviously she still has not come yet, but I kind of just want my water to break so that I know, because I just feel like I'm just not gonna know until it's too late. But I've been working on a couple of things. I had made one of these for, I have a couple of friends who have also had rainbow babies. So I embroidered a boppy cover, and it says, "After every storm comes a rainbow." And then it's got this rainbow fabric on the back. I love it so much. But for those of you guys who don't know, this is a nursing pillow. So, you know, cozy, cozy. And then I did also get in, and I'm gonna unbox it now. When you have insurance, insurance is required to provide you with a breast pump. So even though I still have my breast pump from when I had Caspian, I was eligible for a new breast pump. So I got what I'm assuming is the same breast pump. It's the same company. This is Lansinoh. It's the Smart Pump 2.0. And this is the little, I say little, but this is the box that it comes in. And this comes with a bunch of stuff inside of it. So, goodness me, this actually came with more stuff than the one that I got before it came with. So this comes with phalanges in 2 different sizes. It has smart technology. It includes a tote bag, a cooler, a bunch of accessories. So there's a lot of stuff in here. My set before didn't come with a cooler or a tote bag, and I actually, when I went back to work, I didn't use my electric pump. I used a handheld one. So I don't know, maybe I'll use an electric pump at work now that I have like all this fancy stuff. Unbox it and see what's inside. So it does have the instructions of how to use the app. I didn't actually use the app last time. I don't know if I'll use the app this time. I might check it out and see. It gives you the instructions. I don't know if this is the cooler or the carrier. I think this is the cooler, which is nice that it comes with the cooler. So it comes with the cooler, it comes with the reusable ice pack that like fits right into the cooler, which is nice. So one of the reasons why I chose the Lansinoh breast pump last time is because of the closed valve system that it has. Other breast pumps don't have an open valve system, and then you can get a lot of moisture in the tubes for your breast pump, which can cause mold and just not like the cleanest. It's like this system is more bacteria friendly. There's a lot of other really popular breast pumps that have an open system, and I'm like, that just seems like so much more stuff to clean. So I definitely went ahead and stuck with the same breast pump that I had before. It does come with 2 bottles because it is a double breast pump. This little piece comes off here. This little piece unsnaps, and there is a suction piece here. And then I know that you plug this piece into the back of it. And then the nice thing about this system is it does come with a little plug on it. So if you did just want to pump on only one side, you would pull this off and plug up the side like this. So if you wanted to nurse on one side and pump on the other, you can close off the other side and just pump with one side versus pumping with both sides. So that's a nice thing about this breast pump. Like I mentioned, it does come with 2 different sizes phalanges, depending on what size you need for your chest. It has the AC adapter so that you can plug it in. I want to say that you can put batteries in this too and have it run off of battery power. In my experience with my other one though, it's not quite as powerful with batteries as it is when you plug it in, but it is a nice feature to have if you don't have a manual breast pump, to know that you can use battery power. Comes with 2 extra little valves. It comes with lids for the bottles. It also comes with little bases that you can stick your bottle into. like this. And then it comes with one nipple top, so it has the nipple with the cover and everything. You can buy extras of these. I probably have extras from Caspian. I know like they tell you to get like to change your bottles out every now and then because of bacteria, but I think I actually have some that are like fresh and clean, because once a year, if you're continuing to breastfeed, you can also get a new breast pump accessory kit sent to you. So you can get new bottles, new flanges, and I want to say everything but the actual breast pump you can get new stuff with. Everything that actually touches germs. So this right here, oh, this is the carrying tote. It was rolled up so compactly, I thought it was like in here. So this is really nice. This is the tote bag. There is a spot in here that's insulated to put like a bottle into. There's a mesh bag on the one side, but it definitely is big enough to obviously put everything inside of. And then the actual machine is right here. This is shaped differently than the one that I had before. It has a little handle. I don't know if this one works exactly the same way that my other one did. Once I figure out how to use it, I can kind of probably show you guys how to walk through this. But the nice thing about this one is there's different settings on it. It can remember the settings that you use, actually 3 different settings for pumping. And it has a letdown setting where it starts off and then it speeds up and then it lets down again, which is nice. I really liked this breast pump. I probably used my handheld one more than I used this one, just because of at work it was easier to use the handheld one, I found. But it's still nice to get this one, and I'm gonna try this one out at work. I'll just have to see when it comes to that point. But like I said, there is a spot in the bottom to put a bunch of batteries in so that you can run it with batteries. So one of the things that I also like about this breast pump is instead of only being able to pump into the bottle, you can also just attach the breast milk storage bags, which are made by Lansinoh, and pump right into those, because everybody who breast pumps knows that if you pump into a bottle and then pour it into a bag, you're not going to get every last drop of milk into the bag, and then it's just wasting milk, so it's less changing back and forth. So that's another nice feature about these, is you can pump right into the bag versus pumping in to the bottle. So I definitely already have a bunch of bags ready. We will have to see what happens with breast pumping and breastfeeding with this journey. Caspian was dairy intolerant. I had to cut dairy out of my system completely because he just didn't react well to the dairy in my system. So we'll have to see if Melody's like that. I'm assuming she's going to be, because I'm lactose intolerant, so it wouldn't surprise me one bit if she also has dairy issues and I will have to cut dairy out of my system. It was a sad day. The thing I missed most was pizza, so we shall see. And then with Caspian, my supply dried up at about 9 months, just because I wasn't able to pump as much at work. I am at a different location with work now, so it's not as busy of a place. So maybe I will be able to breastfeed a little bit longer. So hopefully that's the plan. So I am very happy that this came in time. I was afraid that it wouldn't come until after I had her, but I'm excited that it's already here. I have to clean and sanitize everything. But that is really all that's been going on for the past 5 weeks or so. Like I said, by this point I'd already had Caspian, so it's interesting to make it to 37 weeks. If she was born now, she would technically be considered full term. Full term is at 37 weeks. I do have OB appointments scheduled every week now coming up. They did also schedule an induction for me at 41 weeks in case she's not here at 41 weeks, but I doubt that's gonna happen considering she has been head down and dropped weeks ago. I feel like she had already dropped at like 28 weeks. If I look at like some of the pictures of my belly pictures every week, I definitely can tell when she dropped, and she's been hanging out pretty low for a very long time. So it'll be interesting to see when she comes. I kept thinking she was gonna come the week of Mother's Day, and that we got, you know, a few more days till that. It is the 4th right now, and Mother's Day is in 4 days, so I think she's coming sometime next week, so we'll have to see. But as always, guys, I thank you so much for watching. I thank you for joining us on this pregnancy journey, and pretty soon baby Melody's gonna be here, and it won't be a journey of pregnancy anymore. It'll be a journey of, you know, growing up with a little baby girl and her club-footed journey, and just, you know, seeing what other fun adventures that we can get into with Melody and Caspian. Thank you so much for watching. We'll see you next time. Bye.
Let's go.